Nursing homes are off bounds. This is the only way for this Belgian woman to visit. The coronavirus is isolating the elderly.
To see my sister even a few minutes like that, just such a great idea. I feel grateful, first of all, and it was a great moment.
So many others weren't allowed to say goodbye in person, leaving relatives to die alone. In countries like Germany, every second person infected with the virus lives or works in a care centre. The lockdowns are easing, but not always for the elderly. Is that fair?
I got the message I really hadn't expected on the weekend. After 50 days in intensive care, flirting with death, my friend's father had recovered from the coronavirus and was being released. He's lucky. Old people are at highest risk, and neither hospitals nor care homes are the safest of places right now. Our report takes you to Portugal.
In this nursing home near Lisbon, a carer brings 90-year-old Adriano Borges to the visitors' room. He'll be able to see through the window when his daughter and grandson enter the visitors' box, and they'll have to speak over the loudspeaker. "Let me take this mask off so you recognize me," his daughter says. It's an emotional encounter, but a brief one. 15 minutes of intimacy through the protective glass pane. The voices are slightly distorted by the loudspeaker, but it's better than nothing. Up to now, it was very painful. Even though he was constantly keeping up with the news, it was very painful. Now, this method, even though it's not what we want, is a consolation, a way to see each other in a safe way. The visitor box has been constructed adjacent to the nursing home. It's a small room with ventilation and can be disinfected after each visit. There are 2,500 nursing homes in Portugal, and coronavirus infections have occurred in 1/6 of those. That's why no visits have been allowed for 2 months. It's a painful period for everyone, especially perhaps for residents who are suffering from dementia. Some people didn't understand it, some still don't, and think their families have abandoned them. Others think they behave badly and that's why they were deprived of visits. We have several different situations. Through this time of confinement, we try to explain with more calm and patience what's been going on. Portugal is gradually easing the lockdown. Care homes are starting to open their doors. But restrictions like social distancing will be strictly enforced for the safety of the residents.
Gary Kennedy joins us on the phone now. He's Director of Geriatric Psychiatry at New York's Albert Einstein College of Medicine. Georg Markmann is an ethicist at Munich's Ludwig Maximilians University. Georg, starting with you, is it fair, first of all, to segregate old people?
Well, at least there is a justification, an ethical, relevant justification for isolating elderly. Elderly people have an increased risk for severe COVID-19 illnesses and higher risk for fatal course of the disease due to age-related frailty and comorbidities. They often have chronic diseases. So at first hand, there is a good ethical justification to really isolate and protect elderly people from the COVID-19 disease.
But second hand, I can hear a but coming.
Yes, because their autonomy is restricted, and restricting one's autonomy is a problem ethically and from a legal perspective in itself. But it also has negative impacts on these elderly people, especially if they live in care homes. This isolation has negative psychological and physical impact due to the social isolation and the immobility. So they have a negative impact. It causes some harm to these elderly people. So the protection must be balanced against the restriction of freedom and the possible harm that is caused by the isolation of the elderly people.
Well, I think that's one of the biggest tragedies in this crisis is the fact that so many of the elderly have been left to die alone. Gary, can you chime in here? I mean, is it fair? Is it even working? Has it been necessary?
Well, I agree with the previous speaker. The issue is when ethical conflicts arise where there are competing imperatives, the approach is how does one mitigate? How do you manage, moderate, not resolve? So the issue of how do you protect the older person, if you can't protect them, then their autonomy is at risk because of the infection. It turns out that older adults, not in congregate living situations, nursing homes, other long-term care facilities, but those who are aging in place in their own residences, they may be actually doing better psychologically than younger people who's so much more accustomed to being out and about. And older adults have a bit of a psychological advantage as well, is that they've lived through so much that they tend to have, interestingly, a little bit more of an optimistic outlook. Now, I also agree with the multimorbidity and the frailty. That puts the older persons at risk. And for my older patients, I find out frequently that they're having friends or relatives or someone else who are dropping off food and supplies at their front door so they don't have to get out. So they're self-isolating or self-quarantining. And that's one way to try and protect their autonomy, but at the same time protect their health as well.
Georg, back to you. What about all the other high-risk groups? Because the elderly aren't the only high-risk group, but they seem to be one of the only groups that are being segregated.
Yeah, because age is a very easy marker. And especially in Germany, we have many elderly in long-term care homes. And then it was very easy to just lock the homes down. There were no visitors allowed, and the residents were not allowed to go out. I would like to
but
stress...
surely that's not effective. Surely that's not effective, just locking out one high-risk group when there are many.
Well, that's true. So we have to address several high-risk groups. Another high-risk group would be younger adults with chronic diseases or multiple chronic conditions. But it's not so easy to protect them. And you have to just provide the individuals, the adults, with information and say, if you have a certain disease, then you have to be especially cautious and stay at home. But I would like to stress one point that has been mentioned by my colleague from New York. Perhaps we should grant a little more autonomy to those risk groups and let them decide themselves how much risk they want to carry, especially in the elderly. And many elderly said, well, I have lived my life. I will die sometime anyway. I don't want to restrict my freedom. I'm ready to carry this risk. So I think it would be good to have some more individualized solutions instead of isolating whole population groups.
Gary, I just want to ask you one more question. Is this, from your perspective, just a European problem? Because Africa's population is extremely young, Asia and the Americas are somewhere in the middle, but Europe is old.
Oh no, this is a genuine pandemic, and as you were alluding to earlier, others with multimorbidities, compromised immunity, they're at risk as well. And the issue is not locking people up. I think the issue is how do you moderate the risk? Because you can't eliminate risk. So the goal is to try and minimize it, and at the same time honoring the person's autonomy, but also making sure that they may not be so concerned about becoming infected themselves, but if they do become infected and they're out and about, then they're at risk for infecting other people. So there's this difficult balance, and I agree it has to be open, and it is frustrating for people. There's no question. There's no denying that this is a very difficult situation to bear up under. There's just no denying that.
Psychiatrist Gary Kennedy there. And thank you very much also to ethicist Georg Markmann. Now it's your chance to ask any questions you may have on the coronavirus. Here's our science correspondent, Derek Williams.
Do asymptomatic people produce the perfect antibodies against COVID-19?
To answer this, we have to look a little more closely at how the immune system works. It's actually made up of two lines of defense, what are called the innate response and the adaptive response. Now, you can think of the innate response as a general defense that's on constant patrol in the body. It relies on certain proteins and molecules and cells that are always present to quickly clear invaders of every stripe. Antibodies, on the other hand, come from the second line of defense, the adaptive immune system, which involves what's called immunological memory. The adaptive response recognizes very specific pathogens and makes antibodies that flag them for destruction. But it takes time for your adaptive system to learn about those new pathogens. Most experts are guessing the answer to why some people never develop symptoms probably doesn't lie in the quality of antibodies they're making, but rather somewhere in their first line of defense, the innate immune system.
Will we need seasonal shots if and when a vaccine is rolled out?
This is yet another question we'll only be able to answer a couple of years down the road, but we can speculate based on what we know about related coronaviruses and our adaptive response to them. Unfortunately, with this group of viruses generally, our adaptive response seems to wane over time, which is why you can catch less harmful coronaviruses that cause cold-like symptoms more than once in the course of your life. So it seems unlikely at this point that any vaccine for SARS-CoV-2 will really be a kind of one-shot fixes-all kind of a deal. The good news is that with other coronaviruses, immune memory at least doesn't appear to get erased completely, which means subsequent infections with them are usually milder than a first one.
Could a system of infecting low-risk individuals with COVID-19 gradually produce protected individuals and herd immunity?
This idea has been bandied about, but there are several reasons why trying to intentionally infect low-risk people seems to be a pretty bad idea. Leaving aside big questions still surrounding immunity and unknowns about possible reinfection, it's important to remember that although the vast majority of people who've died from this disease are over the age of 50, young people die from it sometimes too. And even if it doesn't kill them, it could cause long-term or even permanent damage. Most of the experts I've read say it's still way too soon for epidemiological experiments aimed at herd immunity through intentional infection, because there's still way too much we don't know about COVID-19. It certainly seems to me like a much safer bet to continue with conservative measures like social distancing to keep numbers of new infections down and give science the time it needs to work out longer-term solutions involving medications or vaccines.